Well, good afternoon, everybody. Just a regular holiday weekend at UHN. First of all, thank you all for working on your long weekend. Thank you for doing so for our patients, and thanks to your families for letting you be here. Obviously, it's my pleasure to welcome Justin Trudeau, the leader of the Liberal Party of Canada, and Chrystia Freeland, our MP for this very riding, University Rosedale. And I know you're not here to hear from me, so I'm going to be quiet and turn it over to our guests.
Thank you so much, Kevin. What a pleasure to be here today with Chrystia, who is not just your MP, but also our extraordinary Deputy Prime Minister and Finance Minister, who has been an unbelievable partner to me through this entire pandemic. The measures we have to put forward, the focus on pulling all of the government together so that we could make sure to be there to support Canadians through this, because really that's been the story of the pandemic, of people being there for each other. But nobody anywhere near as much as frontline health workers like yourselves, doctors, nurses, support staff. What you have done these past 18 months has been nothing short of heroic. The long hours, the scary situations of the unknowns in the very beginning, the creativity, the resilience that you showed every step of the way has just been such a point of pride and marvel for so many Canadians. Le travail que vous aviez fait en tant que travailleur dans le système de santé, d'être là pendant de longues heures, de longues journées, de longues semaines pour protéger les Canadiens de cette pandémie a été inspirant pour tous qui voulaient essayer d'aider les uns les autres, comme on a fait au gouvernement, mais comme des millions de Canadiens ont fait dans leur communauté. I want to say thank you for everything you did, but as Kevin just did as well, I want to say a special thank you to your families. And I know you were certainly thinking of them as you were going into work in those first weeks of the pandemic, uncertain of whether or not you were going to be putting your kids at risk, your loved ones, maybe your parents at risk with everything you were doing, and you still stepped up. You still kept to that commitment you have to community, to each other, to your fellow Canadians. And that was inspiring to me personally, but it was inspiring to all Canadians. And that's why it's so difficult and so horrifying to see images of you and your colleagues, including right here at this hospital, being harassed and intimidated by anti-vaxxers in protests. It is something that we've seen not just here, but in Vancouver and right across the country. And I want to tell you something. All of Canadians stand with you. People know how hard you've worked, how much you've sacrificed to do this unbelievably important work of keeping us all safe, of seeing Canada through this pandemic better than just about any other country in the world. And that is so much of it on your shoulders. And to see you attacked, let me tell you, I, for one, will always be there to have your backs and stand with you. And a big part of that is making sure that people get vaccinated. I will be unequivocal on that until and beyond the end of this pandemic. It's the only way through. And sorry to the other leaders who think that somehow testing is equivalent to vaccination. It's not. We need to make sure, and we have done it in the federal areas of jurisdiction. All federal public servants will be vaccinated. Anyone getting on a plane or a train, which are federal areas of jurisdiction, will be vaccinated. Not just to incentivize those who are still hesitating, but because when you get onto a plane, you don't want to worry about whether the person sitting across the aisle from your 7-year-old is going to put them at risk. We need to be doing the right things, and that's why we're also working with provinces like the province of Ontario that is stepping up on vaccine certifications to make sure that people can get back to normal as best as they possibly can, as quickly as they can, with things like restaurants and movie theaters and gyms and other things, knowing that the people around them aren't putting them at risk. That's how we get through it, and that's also how we support you from having to see the heartbreaking stories of people who were hesitant and are now in the ICU. people whose presence in this hospital, where they shouldn't have to be if they had gotten vaccinated, is actually displacing other treatments and other surgeries and adding extra hours to your day in a way that is heartbreaking because it was so avoidable. These are the things that we will continue to stand with you on, even as we reflect on the lessons of this pandemic, how we build back better than before, how we recognize the vulnerabilities in our communities, in our society, which is why we will continue to stand for a universal public healthcare system, not encourage more arrival of private services like the Conservatives are talking about, but also step up to make sure more Canadians have access to family doctors or primary care teams. There is better opportunities for mental health supports, because we've seen the anxieties and the impact of mental health exacerbated by this pandemic, but things that were already there before. Better supports for our seniors as well. Lots of things that we need to continue to work on, from housing, because I know buying a home anywhere in the GTA is a massive challenge for even folks who do great and important work like all of you. We've stepped up with a real housing strategy, and also moving forward even more aggressively on the fight against climate change, because if we've learned anything about dealing with the crisis, and this is something that all of you probably know, you want to act immediately, you want to act strongly, or as early as you can. So we are going to be even more ambitious in our fight against climate change, and to make sure we're creating good jobs. Other things, at a downtown Toronto hospital like this, you see too many gunshot wounds. We're going to be stepping up on more gun control, as well, as I'm sure you've seen in the news today, as the Conservatives are trying to figure out their position on that. We are unequivocal. More gun control, keeping assault-style weapons off the streets, and making sure we're keeping everybody safe. These are the things that are a really important choice for Canadians in this election campaign. But mostly this here today is an opportunity for me to come around and say thank you. So I will end my speech now, and because I know Chrystia and I are both really looking forward to saying hi. Merci pour tout ce que vous faites. Je vais permettre à Chrystia just de dire quelques mots.
Okay. Merci, Monsieur le Premier Ministre. Hi, everyone. It is great to be here in Toronto and in University of Rosedale. I want to tell you guys one thing that you may not know, which is that Kevin played such an essential role in the federal government response to the pandemic. Right at the beginning, when I was chair of the COVID committee, I was on the phone with him constantly, often at 10 or 11 o'clock at night. And so, he gave really, really valuable advice, and also just helped me to understand exactly what was happening on the ground here. So I really want to pay tribute to his leadership and thank him so much for that. And you guys should all know that you were very much a part of it. And beyond that, I just want to say, coming in here, it makes me so proud to be Canadian. You guys are one of the top 10 hospitals in the entire world. And of those top 10 hospitals, you are the only one where any person can get treatment here, and where every single person in Toronto can come in here and get treated regardless of how much money they have. That is not true of any of the other top 10 hospitals in the world. And that is, to me, that is something to be so proud of. That is such an amazing thing about the work you do. It is such an amazing thing about Canada. And just thank you so much. I can't believe how hard you've been working. I can't believe the kind of stress you have been under. Et ça me fait un tellement grand plaisir d'être ici pour vous dire personnellement un grand, grand merci.
Not too close.
I'm tired.
Yeah.
I'm tired. It's been a long road, 18 months. 18 months.
Yeah. And the various waves that we've gone through have been not enough to give you respite between the two of them, eh? Sort of catching up on things that got delayed, eh?
Not really. There's been a little bit of respite. I have to say, I couldn't, I've been doing this for 32 years. I've been an ICU nurse. I was at the bedside for many years, and now as the manager for the last 15. Couldn't be prouder of my team. They were unwavering. From the get-go, from wave one, it was, how are we going to do this? Every patient mattered. I think what struck me the most was they left their families, as you said. They left their kids, they left their husbands, they left elderly parents that they were caring for, and yet came in despite the fear, despite the fact that, you know, the information, the science was changing, especially during wave 1.
Yeah.
Was changing almost on a daily basis. You didn't know, am I wearing the right PPE or not? How is this really transmitted? Is it droplet? Is it airborne? What is it? But they came in, and they still come in. They're tired, and it does worry me. You know, moving forward, I could retire. I could have retired 2 years ago. I chose not to because I didn't feel like I could leave my ICU. You know, I'm the manager in the ICU. I couldn't do it. But I hope that young people still choose healthcare as a profession. And that's what worries me. Will they? I never thought in my career I would see this. I nursed through SARS. This was very different and continues to be different. And I think probably one of the biggest things I want people to know out there is trust the science. I'm vaccinated. Please get your vaccine. Protect yourself, and more importantly, protect your colleagues and everybody else around you. This isn't a conspiracy theory. It's real, and we're living it every day, and we see it every day. And you know, the nurses and doctors and RTs that are at the bedside, my hat's off to them because they go in every shift and look after these patients.
Well, Kevin was telling me that you're now seeing in the ICUs, it's the unvaccinated people who are there.
So unfortunately, we're full today.
You're full.
So we are at full occupancy. That's 38 beds full. That happened in the last 5 days. And we have increased our number of COVID positive patients. They were all transferred primarily from other downtown GTA hospitals because we offer extracorporeal life support, which no other hospital does. Well, we're the center, the experts. They're all unvaccinated. They're all unvaccinated. So that's concerning. Right? That's concerning. So
Thank you so much.
You're very welcome. You're very welcome. Thank you for
keep
coming.
spreading that message. Thank you.
Yeah, thank you very, very much.
What's your name?
Ruth.
Pleasure to see you, Ruth.
Nice to meet you guys.
Thank you.
Thank you so much for all that you guys have been doing. We know it's hard as well.
Thank you for what you've been doing. Anything, like, we put in a few long hours, but nothing like what you've done.
We would actually say if we were feeling tired, just remember the healthcare workers are working a lot harder in much more difficult circumstances than
Thank
we
you
are.
so much for understanding. I do have a question. Since the pandemic, a lot of nurses have been burnt out and a lot have voiced concerns. I believe there will be an exodus of nurses leaving the profession. What strategies do you have to gain retention for the nurses? And also, when it comes to the vaccine, a lot of people are not only fearful but have lack of information. Even myself, I read the 53-page report before getting the Pfizer. I was able to sit down with patients who were worried about it or had concerns, that I was able to give them more information, insight. What can we do as a whole, as a nation, to increase awareness and education? So it's a two-part question.
Well, first of all, we will be funding more in the Canada Health Transfers for Health to the provinces. We're going to work with them so that we get it right, so that there is actual measurable deliverables that are making that happen. But just like we stepped up with billions of dollars in transfers to the provinces to help through this crisis, we'll be there for reinvestment and growth in the kind of quality care that we need to give, because we know how hard nurses and others have worked. Secondly, on more encouragement, we're continuing to reach out in all sorts of different ways, in language, in culturally sensitive information to get over some of that hesitancy. But we're also at the point of putting very clear incentives for people to get vaccinated, right? If you want to get to the restaurant, if you want to go to the gym, if you want to get on a plane, if you want to think about going south after this horrible year, you're going to have to get vaccinated. And I think a combination of being, having all the information there for people who want it, but having that clear incentive that, well, you can't do all sorts of things if you don't do this for your fellow citizen, is going to be the right combination.
Great, thank you so much.
Yeah.
Thank you. Of course. your name?
David.
Pleasure to meet you. Thank you. Where are you working here?
General medicine. Yeah. We were actually, I worked the first COVID unit in UHN, so that was really exciting. So it's nice to kind of see you and like hear from you regarding like all of COVID and like our response.
Thank you
Yeah, I
for,
really appreciate
for
it.
stepping up in such a huge way. You know, all of Canada is so grateful to everything you guys do.
Yeah, I really appreciate you like really standing behind the vaccine and all of those initiatives. 'Cause
Standing up for science, it shouldn't be a big thing, but
Yes.
unfortunately these days it
Yeah,
is.
Yeah. And it's been an ongoing thing, so really appreciate it.
Yeah, and we're proud of you guys. Like UHN is really leading the way in terms of saying, okay, the time has come. If people want to work here, they have to get vaccinated. That's very fair, and that's what we all need to do.
Thanks so much.
Thanks.
Hi there. Hi. What's your name?
Nate, nice
Pleasure
to meet
see
you.
Nate. Thank you so much for everything. Thank you. What are you doing here?
I'm a nurse in general medicine as well.
Excellent. Thanks for everything you've done to step up. Thanks so much.
No worries,
Great
will you
stuff.
grab a bit?
Of course. Come on over.
Perfect. Thank you so much.
Thank you.
Hey
there. What's your name? Morgan. Pleasure to meet you, Morgan. How are you doing today?
Well,
Thanks for working on a Sunday. It's just, although the days sort of blur all
they
together.
do blur
right?
together.
Yeah. Wow, it's a really important time.
Yeah.
And it's been amazing to see how people pull together, but particularly you guys.
Yeah, we work really hard.
Thank you.
You're still working hard.
Yeah, exactly. Yeah, there's
We're
still,
still
we're not
here.
through this
We're
yet.
still here.
Thank you so much.
Thank you so much.
Hi there.
Nice to meet you.
What's your name?
Kathy.
Nice to meet you, Kathy.
How are you?
Oh, very, very well. Thank
Had
you
a
so
busy day today.
They're all busy and filled with great people to meet as well. Did you want a picture, Kathy?
Oh yes, I would love one. I have to prove to my husband that I did, that I did meet you.
Just stand
so.
up beside me. Here we go.
Thank you.
Thank you so much.
Oh, thank you. Thank you.
Thank you. Ça va très bien. Hey, tu viens d'où?
Montréal.
De Montréal. Ok.
Ouais.
Ça fait combien de temps que tu es ici à Toronto?
Ça fait 8 ans.
8 ans. Tout ici?
Ouais, 8 ans comme patron, 5 ans pour le training avant.
Oui.
C'est une belle place, c'est un bon hôpital, on est heureux d'être ici. Merci pour ton leadership. Merci pour avoir fait des choses qui n'étaient pas tellement populaires. Je pense que surtout après les élections, on verra qu'est-ce qui va se passer. Il va y avoir beaucoup d'autres choix et de décisions difficiles à faire. Mais on pense que ça va être correct. Ça va bien aller. Je suis capable de faire ça.
Je compte sur les Canadiens de faire le bon choix. On va s'y mettre. Veux-tu une photo?
Oui, surtout. Ma fille de 6 ans va être bien contente.
Oh, elle s'appelle comment?
Héloïse.
Héloïse.
Merci.
Merci beaucoup.
Plaisir.
Plaisir aussi. Very well. What's your name? Arthur. What's here? Arthur, what do you do here?
I work in the ICU.
The ICU, you're
Yeah.
ICU doctor?
Yeah. No, nurse.
Nurse.
Yes, yes.
Pleasure to see you. Thank you. It's lots of unvaccinated COVID patients.
Are coming now? Yeah.
Are you seeing many vaccinated breakthrougs or?
We do.
in the ICU?
Well, we see mostly unvaccinated right now, and so I guess the hard conversation now that we're having is beds are being occupied by unvaccinated patients.
Yeah.
And then the problem with that is then decrease in ICU beds then leads to
backlogs and other people needing the support.
Exactly.
Now, what are people saying when they come in with COVID and admit that they didn't get vaccinated when they could have? Are they?
But they don't believe COVID exists, right?
And,
So
and
they're-
they still
then-
they starting to be convinced.
They
or-
started to be convinced a little bit, and they're like, "Why am I so sick?" And we actually say, "Because you have COVID,
And
then
you didn't get vaccinated.
And you didn't get vaccinated." Yeah. So, yeah. It's
We're there to help everyone,
Yes.
but it's when people help themselves first,
Exactly.
it takes away the pressure from everyone
Yeah,
else.
it does.
Well, listen, what a pleasure to meet you.
Yes. Do you mind if I get a
It'd be
picture?
my pleasure.
Okay.
Absolutely.
Okay.
Thank you so much again. Thank you. Hey there. What's your name?
Andrea.
What do you do there?
I'm a respiratory therapist here.
So you've been very busy over these past 18 months.
Yes, very busy. Yeah.
And tell me about sort of the shift of things. I mean, obviously, this is one of those places where the patients will keep rolling in, but now they're more unvaccinated than vaccinated.
We are seeing that. Yeah, we are seeing that. Yeah.
And what sort of conversations are you having with people who decided not to get unvaccinated and are now finding themselves through?
Well, honestly, the patients that we have that are not vaccinated are all very sick and sedated.
So they're not
on
actually
ventilators.
talking much
so
at
we're not
all.
able to speak with them. It's disappointing. It's sad to see because these could have been preventable. It's not to say they may not have got COVID, but their stay in hospital or even just stay at home could have been less complicated. So it's I wish we weren't heading into this fourth wave with most of the people coming in being those who have not been vaccinated.
Well, I mean, everyone else deserves to be able to get back to a little bit of normal, and that includes you guys as well. You should be dealing with colds and other things, not just back to school stuff, as opposed to having people fill up the space that shouldn't.
I agree. Thank you very much for visiting.
Thank you. Would you like a picture?
Yeah, I thought I'll jump on this selfie.
I'm happy to. You guys, anything you guys want, I'm happy to.
I feel silly, but
no, not at all.
Yeah, we're smiling. Yeah.
It's in the eyes.
Yeah. Thank you so much.
Hello. How are you
Nice
doing?
to see you.
Pleasure to see you as well. What's your name?
I'm Dipali Kumar. I'm one of the doctors in the transplant program, in the
boy.
organ transplant program.
So you know how incredibly vulnerable so many people are.
Absolutely. So, what I wanted to tell you is that, right here in Toronto at UHN, we did the world's first study on vaccine boosters in transplant patients. And that was published in the New England Journal of Medicine, one of the best journals.
I know it.
And that because of that study in Ontario and other parts of Canada, we are doing boosters in transplant.
That's what Kevin was saying.
Yep.
That you've discovered that the immunity. I mean, the vaccines work for immunosuppressed,
right,
but the immunity disappears a lot.
That's right. And so the booster dose is a dramatic benefit, and because of that, the FDA in the U.S. and now the European agencies are contacting us for information. So this is a great place to work. It's the whole point of that.
Cutting edge.
We're right at the cutting edge, so we're really moving things forward. So
thank you for everything.
Thank you for coming.
No. What a pleasure to be with this.
Yeah, it's really nice. Yeah, and one thing I wanted to say was,
of course,
one of the reasons we're at the top in the top 10 hospitals is because of transplant. I just wanted to let you know
you
that.
should be very proud of that.
Thank you. Can I get a picture?
Of course.
Okay. Yeah.
Here we go.
Yeah.
I got the second one.
Okay. Oh yeah. I think it's this one. Oh no, we got it. Yay. Thank you.
Thank you so much.
All right. Take care. Right here, sir.
You did?
I know, I couldn't.
I'm getting. Thank you for coming.
I work mainly in triage, in charge sometimes. So triaging, obviously, we get to see a lot of the...
I was going to say, how are you making decisions between people who come in sick with COVID because they're unvaccinated and people who are coming in because they're terribly sick with something else but maybe not as sick? I mean, who was it? Heather was asking that question this morning, actually. What are you thinking on today? What are the protocols?
So the protocols is the same, regardless of they're vaccinated or not. We see the sickest people first.
Yep.
We triage based on the acuity of the patient's care, and we sort of go by there. And obviously, we are seeing a lot of young people coming in now that are unvaccinated that are having COVID, which is sad.
Yeah.
So, I think we're educating as much as possible, but out in the media, I wish we could provide more education for people in terms of just, get your vaccination.
It really matters.
It really matters, yeah. And just another thing too, just asking in terms of how can you provide some more services to the nurses and other staff members of the emergency department and throughout the hospital for just burnout. I'm seeing a lot of burnout within staff, and we want retention, in terms of future what sort of supports do you implement with that, do you think?
Well, listen, we need to make sure that we're continuing to invest in healthcare. We've talked about the fact that we're going to be increasing transfers to the provinces, and we're going to be working with them to make sure that Canadians are seeing results. We've seen some areas, long-term care for seniors being a place where we haven't been doing well enough for years or even decades that we have to turn around. But more, how we're making sure that the health human resources are properly invested and people are supported, because you signed up to keep people safe, but nobody signed up for this pandemic, right? And you've gone above and beyond, and we need to make sure we have your back.
Yeah. Well, thank you for coming. I just want to get one picture with you.
Of course.
Just for my family, they're asking.
Of course, just for your family.
Just for my family.
Yeah.
Thank you.
Thank you.
Nice meeting you. Right here, sir.
Heather, you want to talk to Cleo? That question you asked me this morning. Yes. Well, yeah, she answered it for me. It's a good answer. Hi there. What's your name?
I'm Jason.
Pleasure to meet you, Jason.
Nice to meet you as well, too. I'm the in-charge nurse from Med-Surg ICU. So I've been looking after this, helping taking all the sickest patients into if leading to doesn't work for them. Bit of a challenge and whatnot, but something that resonated with you, whether you mentioned, was the fact that we've had to get creative with staffing and just managing.
I saw pictures, and I can't remember where the hospital was, of tubes coming in from the hallway. So you didn't have to go through the whole infection control prevention to get inside and out, so you could monitor people
exactly,
from.
To minimize exposure.
Exactly. Just to cut down on the amount of changes of PPE if you go through as well.
But most important thing too, I think it's we've gotten creative with how we manage the sick patients, but also just staffing. I think in the third wave, I don't know if you remember hearing some of the nurses from Newfoundland and Labrador.
Yes, who came in. Yeah, the Premier's wife came in. Yeah,
exactly. So that was fantastic. It's funny. It was only a small group, but they actually made a very big difference, right? Because I would look at it, if we didn't have those 2 or 3 nurses from Newfoundland and Labrador, we'd be even in worse off shape.
It was emblematic of the way Canadians were there for each other.
For sure.
Well, thank you for everything. One picture.
Thank you so much.
Thank you for everything. Hi there. Very well.
Thank you for coming.
You've been busy.
Well, and actually partway through the pandemic, started working with Denise, the manager in the unit, as a point by manager, just to give her some support as the unit expanded over the course of the pandemic.
Thank you for your leadership. We're hoping to get through this soon, but there's still a little more work to do.
That's so funny, because on my way down here, my wife and I were talking because someone had given us a bottle of wine, as a thank you for working through the pandemic. And she says, "When do we get to drink when this is over, if this is over, So.
Yeah, well, you can look at different pathways and some things that happened in the UK amongst the unvaccinated. There might be good signs on the horizon, but in the meanwhile,
it's
so unknowable.
And it's health equity work, and it's putting small communities in charge of themselves so that they can bring their members along.
So much.
If you distrust science, that's fine, but maybe you trust your neighbor, or you trust the guy down the street that you have a relationship with already, and then you build piece by piece. We need so much help in terms of the public health message.
And reassurance. It's interesting. A couple of years ago, I fell down the YouTube rabbit hole of flat earthers and why. You understand it's not actually about that. It's about this countercultural. I don't trust the system writ large. And unfortunately, that same thing has translated into anti-vaccine in schools and kids. The measles outbreaks in California, and there's a scary trend line that is linked to so many other things that we just have to figure out how to counter.
have a relationship with somebody and you say, you know what, I'm seeing it. You know, everyone in my neighborhood knows what I do for a living. Everybody in my neighborhood comes to me. Well, every neighborhood needs somebody that they can talk to, that they can trust. They need a public health nurse. They need somebody in science who is able to talk
And that's what
to
just
them with normal words, right?
and that access to your own GP, right?
Exactly.
I mean that point of contact is so important. And so many people don't have a family doctor or even a family primary care team, or all those things.
Exactly.
That's where we have to start getting into. Out of institutions are important, have their space, but that community based and that self care is so important.
Exactly. That person you know, that your mom knows, that your dad knows, that you trust. Exactly right.
What a pleasure to say thank you to you.
Thank you very much.
Absolutely. And what's your wife's name?
No, it's
Oh, excellent. Well, we're working on protecting her too.
Please become very
Yes.
How old are your kids?
5 and 3.
See, my youngest one's 7. Can't get vaccinated. So
I know, it's a little bit like...
back to school is a little more stressful than I'd like it to be, but I tell you, I dropped him off last week, and he was earlier this week. No, it was Sunday, so it was last week, yes. He connecting with his little friends, figuring out they're in the same class, all wearing masks, but all so excited about being back to school for real. Because grade 1 was supposed to be big boy year, and it wasn't, because it was women's and they're still a little younger and needing daycare. I'm sure.
we have a caregiver, but you know what? We're doing Montessori school. I was just saying, my youngest one is starting on Tuesday, and he's so excited. And my eldest is just happy to go back to senior kindergarten and just be with his friends. And he's good at wearing a mask, and he recognizes mommy works at hospital and deals with the people who are sick with the virus, and he's so aware. And it's so amazing to watch how much they absorb and how much they know what's going on. And I try not to lie to my kids. I try to be very honest with them and recognize that he was upset that I was coming to work today, and I just wanted to get home. And I said, mommy's taking care of right? They just pull at the heartstrings, right? Mommy has to go to work and take care of people who have the virus, and but he's understanding. Like my 5-year-old, he's like, okay, I get it. Yeah. So
I'm sure he's very proud.
I hope so. I'm trying my best. I'm doing it for him.
But that's part of it, right? You think about, okay, there's all those times I could be with them if I wasn't doing this job, but what I'm doing is making sure they get a better future. That's how we rationalize some of our time with them.
It's tough. I don't know, to be away from them all the time. It's just the early years are the most important years, right? And sometimes coming back to work 12-hour shifts, it's hard. I sometimes have so much guilt of coming here, and then just guilt of going home and potentially exposing them to all of this, and I never had that fear before. Like that fear was never there.
Now it's a little more acute.
Yeah, it's a real fear.
Well, that's why we have to get everybody vaccinated.
Because it's not fair to you, it's not fair to your kids.
100%. We both agree, my husband and I. We're like, get everyone vaccinated.
You want a picture?
I'll find the file.
Oh, is that them? Oh,
yeah, these are. This is Avery.
Yeah.
And that's here. Thank you again. Thank you.
Monster, nice to meet you. Thank you for coming by on behalf of everybody here. It means a lot for both of you to be here.
It's just an opportunity to say thank you on behalf of so many Canadians who are so deeply grateful.
He's too kind to play this, but this guy is at the center of the ICU and our occupational health work. Dr. Branton has been a pillar of our COVID response. So you both should
That's
know
very
that.
kind. Thanks, Kevin.
Thank you for all your leadership. Well, now you, judging from the gray hair, you were around during SARS, were you?
I was. Yeah.
How do you feel?
I know.
Lung environment, but I'm going to take out because I want to know. How have you seen things evolve over the past couple of decades? What have we learned? What have we not learned? How is that helping in terms of this?
Well, to me, it's amazing what we haven't learned. I think we revisit this Spanish flu and everything else. You can see all the signs and exactly that hesitancy, that education, and the importance of public health policy and the skepticism that was back then continues. So I don't think we've learned a lot, unfortunately, and we're still seeing those sort of hesitancy and concern at being vaccinated and public health policy and good practice, and it just baffles us as to why that is.
Well, I have to say I really admire the approach you guys are taking here at UHN and being firm and saying time has come. If you want to work here, if you want to take care of patients, you need to be vaccinated. I think that's real leadership.
Well, it's similar. It comes down at all levels of government as well to have that support as well. And we see that. A move to federally mandate that on trains and planes is very important for us.
In the areas we have.
Exactly.
The Prime Minister felt very strongly personally that us taking the lead would make it easier for everyone else to act in their areas.
That's the thing. If you look at us as the largest employer, saying, okay, as an employer, we're going to say all employees, everyone who works in the public service needs to be vaccinated. Then you can imagine other companies saying, okay, if the feds are doing it, then we can do it in our industries or our everything. But we also put into the platform that we're going to defend businesses that get sued for enforcing vaccinations, because that shouldn't be happening. No, exactly.
That's good. Oh, I appreciate that. I really wanted to say, too, thank you for all the hard work in securing the vaccine supply, which is fantastic. I know it was really bumpy at the beginning, but it's...
Well, I talk to Kevin every step of the way, so I'm sure you actually know a lot of the gory details.
No, it's fine.
But the interesting thing, as people talk about what we learned, what we didn't learn, where the mistakes, the scramble we had on PPEs, I remember, Chrystia, you were one of the first people who brought up, okay, what's the next scramble going to be internationally? Like, what's for vaccines? And we're like, what are you talking about? Vaccines are like years away. No. Vaccines are going to be the next international competition. So we basically pulled out all the stops and sent Anita out to negotiate deals, and we got it. But Canadians did their part as well, right? And we're now leading the world on that, but not good enough. We need to get further.
Good, I appreciate it. Well, thank you very much. And again, thank you for coming by. It's a pleasure meeting you both.
No,
take care. Take care. Best to your families. Okay.
John, would you like a picture?
Sure. Somebody's willing to take my picture.
Here we go.
Oh, come on in, please. Oh, yes, please, if you don't mind.
Oh, John, we are going to be...
I'm going to tell John is being too polite. He can delete it if he doesn't want
and she's probably more well-known than you are because she's the voice of the CBC for infection prevention and control.
I have to say, you're doing an amazing job of keeping people informed and reassuring them.
Thank you.
And challenging us when we all, as leaders, needed to be challenged.
Well, I appreciate everything. It's been a very, very difficult time for everybody. So.
It really has. But Canadians once again showed the best of themselves, and for the most part, that's what people are working on.
It gets harder and harder for people to stay motivated. I think that's one of the things that I worry about the most.
Yeah.
So let's hope that we continue.